Hello, Contra Costa County. Buenos dias. My name is Mika. I use they, them, theirs pronouns. I identify as a queer, non-binary, disabled member of the Latin community. This video is a takeaway video from the workshop An Intersectional Approach to Latin Wellness Disparities, brought to you by Contra Costa Health Wellbeing Team. You can find their email here on the screen if you have any questions. And the information that I've provided is based off of research, clinical experience, and lived experience. So please take a moment to center yourself, find breath throughout this experience. Please prioritize your safety as a personal practice for well-being. Before we can talk about wellness disparities in a group as huge as Latinos in the United States, we have to center the foundation of intersectionality. This term has become so important in our socio-political context over the last 30 years since it's been coined. And it was coined by Kimberly Crenshaw. There's a quote from her here on the left that you can read. Intersectionality is basically this idea that we hold multiple layers of identity on a social context level, and that the way that these multiple identities meet and intersect create a unique experience of opportunities and barriers for each person. So it's this idea, Audre Lorde said, there's no such thing as living single issue lives. And this goes hand in hand with that. It's the idea that there's not a race problem over there, a gender problem over there, an immigration problem over there, a queer problem over there, that by creating these isolated experiences, we erase the experience of people who are subject to all of these things. And we need to hold that when working in this industry, wellness, medical, just general well-being, and when we're talking about wellness disparities. So keeping that in mind, there's on the left here some intersections to consider that was coming up in the research, different aspects that impact these disparities that we'll talk about. And this list is not comprehensive since this is just a takeaway video. I'm just going to talk about what the research was really highlighting. So more than any other racial and ethnic group, Latinos in the United States are less likely to have health insurance, less likely to have a primary care physician, less access to preventative care, and more difficulty finding a doctor. And what the research was really highlighting is that there's real gaps in disparity based on age, immigration status, gender, race. Race was a big one. Darker skinned Latinos often had to advocate 3 times as much as light skinned Latinos. Education was a big one. Actually, interestingly, younger folks with higher level of education had a harder time navigating the healthcare system. So again, there's a lot of different intersections to consider. And when you really dive into the research, you can see how the way that the system is set up does create barriers that lead to a self-fulfilling prophecy, so that Latinos tend to have more pre-existing conditions, which does make it harder to get insurance, harder to find a doctor, harder to be taken seriously, and it just kind of feeds this cycle. So we did talk about some cultural barriers in the presentation, and you can visit the slide deck to see more information about that. And so, how do we face these disparities in the wellness industry as providers? You may have heard this term cultural competence quite a bit, especially since 2020. And it's this idea, it's a systemic solution to wellness disparities that basically every organization or system should have some protocol in place so that every provider can offer good service to any patient, regardless of their cultural background. And this is a great idea in theory. What really needs to be centered about this is the mindset or the approach or perspective that you have to embody and adopt in order to reach the goal of cultural competence. It's this frame of approaching patients and people from a place of deep respect for their culture and the wholeness of their identities. It requires surrendering your authority, your idea of superiority or expertise, any assumptions you might have. And in order to reach a genuine place of competence, it's critical that you reflect on your own identity, on your own intersections, and the power and privilege and disparities and inequity that you face day to day in this social system, in this medical system. I've provided a graph here so that you can take the time to do this self-reflection. On the left, it's a power and privilege chart. This is an intersectional approach. So you can see there's multiple different categories around the edge. The idea is the closer to the center you find yourself, the more concentrated power and privilege that you hold, meaning the less barriers that you experience in this society. And the closer to the margins you find yourself, the more marginalized, the more disparate your power experience. So I'm going to leave you with some action steps today, things you can do today, this week, practically to bridge this gap in disparities. Learn more about the advocacy groups available in your area that support access to resources for minority groups in healthcare and wellness. Pay attention to what your organization offers as far as diverse and accessible care. The most important thing you can do for Latinos right now is to advocate for translators and language services. Reflect on your own positionality and intersectionality so that you can understand how you contribute to the power dynamics that show up in the room. And when you are engaging with patients and people, hold compassionate awareness and curiosity. Give them the benefit of the doubt that they're doing the best that they can with what they have. Thank you so much. Muchísimas gracias. This wellness session was brought to you by Contra Costa Health Wellbeing Team. Their email address is here if you have any questions, and you can stay in touch with me as well. Thank you.